Good afternoon, everyone. I'd like to call this the September meeting of the Jail Oversight Board of Delaware County to order. If we could all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In addition to who we have in person today, we also have joining us virtually Judge Whalen and Jonathan Raheem King, as well as our solicitor, Shelley Smith. I'd also like to mention, in terms of housekeeping, we had an executive session yesterday to discuss matters of public safety and contractual matters. And with that, I think we can move on to the next item, which is our first round of public comments. So if there's anyone from the public who would like to speak on matters of the agenda, please go to the podium and do so now. Hearing none, we can move on to an approval of the minutes for August. Is there a motion to approve the August minutes?
I make a motion for approval of the August 2022 meeting minutes.
Thank you, Ms. Love. We have a motion and a second. Any questions or comments on the minutes? Hearing none, all in favor? Aye. Aye. Any opposed? The ayes have it. And next, an approval for the August reports. Do we have a motion?
Through August reports.
Second.
Thank you, Raheem. We have a motion and a second. Any questions or comments on the reports? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it. All right, Warden, I think the first thing on our agenda for you is the review of the 2023 draft budget. Or is that Howard that's going to be taking the lead, or am I looking at an improper?
Unfortunately, I was to remove that and did not do so in terms of the agenda.
Okay, well then we're striking that one from the agenda for today. We can table it. Warden's report.
Sorry about that confusion.
No worries.
Good evening, Board. It is wonderful to be present again for this month, and if Sean can assist me, we will get the presentation up and running. While we're working on that, in the interest of time, our first slide typically addresses COVID-19. So Delaware County is still in the medium transmission rate, which is the same as last month. We are currently seeing consistent, standard of infection control within the institution, as well as incidence rate. In the month of August, we tested 95 incarcerated persons utilizing PCR tests. 6 out of the 95 did test positive. Comparatively, the month before, we had conducted 98 tests with 6 testing positive. We do currently have 6 individuals who are testing positive at present moment and working through their recovery process. We've additionally placed all of Unit 9 on a quarantine status to ensure that we have mitigation measures in place. When we have a unit on quarantine status, we do temporarily suspend their visits. That notification did go out on the website. We anticipate a reassessment of the entire unit tomorrow, and further determinations will be made. We are very hopeful we will be lifting the quarantine status for that unit and restoring to full operations. We did not host any vaccination clinics in August. We do currently have 40% of our incarcerated persons are vaccinated. In the month of August, 11 staff tested positive, and right now we do have 4 staff currently within their recovery process of COVID-19. Our current population as of today is 1,324 incarcerated persons, which is a decrease, please excuse the typo, from last month's meeting. Our weekender program remains suspended until October of '22. Our total commitments for the month of August was 598. In July, it was 590. Total discharges was 598 as well. In July, it was 553. We made some important operational changes within the month of August. Previously, due to mitigation measures, we had been doing tier exercise, sometimes also referred to as split recreation within the facility. We have expanded recreation opportunities to have full blocks. So every person that is able to come out of their cell during periods of recreation has been afforded that opportunity. We have, as is typical, had some instances where blocks were shut down for security needs, but the majority of April beginning on, August 8th, we have been doing full housing unit recreation for the entire population to increase their time out of cell, as well as accessibility to phones and programs throughout the facility. We did experience a major incident in August where we had a phone outage for 4 days. We had trouble resolving that with the company, and we've learned through this process that we do need to add additional redundancies within this, the facility to ensure that we do not have decreased contact in the future. This did not allow for individuals to successfully order commissary. We did implement a paper process for ordering, but as a way to resolve that within the population, we did provide commissary gift packs to everybody because of the inconvenience during this time period. We maintained the number of shakedowns, pat searches, and cell searches from July to August and identified serious contraband 12 months during this reporting period.
Warden, with regard to the phone incident, is it an issue on the phone provider's side, or is this something on our end that needs to be addressed?
This was a larger networking issue with the provider, the service provider. We had a number of technicians at the facility that were doing surveys and testing throughout the entire time. GTL Viapath really supported us in working through some of these challenges in the institution, but ultimately we had to wait for the service provider to resolve the issues on their end. There really wasn't anything that we could do within our department.
But they're addressing whatever they need to ensure that we don't have a 4-day outage in the future?
Yes. Any other questions related to the initial statistics? Thank you. Since our transition occurred, we had 13 classes complete the basic training academy. We just started a few weeks ago a new cadet class with 19 officers. We also had 11 officers join on the 9th, cadets. They were working towards their training to achieve the rank of officer. We will also host cadet academies on the 26th of September. We've added an additional class due to filling our September 26th class already for October 10th. And are projected to also host classes on the 24th of October and November 28th. We do maintain flexibility to increase the number of classes offered should we have interest in available staff. We do not want to contribute to delays if there are persons that are willing to work and able, so we are working very hard within the training department, as well as human resources who's doing onboarding, the controller's office who's been supporting us all along the way to make sure that we get necessary staff in. And you can see the two pictures. So the top one is the class that just graduated on the 9th, 11 new officers. And then in the lower picture, you can see some of the command staff as well as the training department that see the individuals through their experience in the training academy. We also had on the far left, Jillian Kaspari, who is one of our academic instructors, had completed her initial training, and she was recognized as well on Friday. We are still, of course, seeking additional employees. And we will be adding to the website the rank of sergeant. And we are going to be seeking, possibly, external candidates if they are interested in applying and working for our institution. We are very hopeful that we will be able to fill the vacancies that we have as soon as possible in all of these roles, but wanted to remind individuals who might be listening that we do have competitive salaries, sign-on bonuses, and training that they are paid full-time throughout their academy process, and we would love to have them apply. There are multiple ways that they can do so. One of the preferred methods is going to the Delaware County career page and applying online through there. And with support from the board as well as county council, they can identify an internal employee who recommended that they seek employment with us, and that employee would be subject to a referral bonus as well. We had 3 individuals who were named Employees of the Month for the month of September. So they are currently parking in the parking spot. They were recipients of their certificates. Their personnel files also received them. It has been really wonderful over the last couple of months because we're having staff very thoughtfully nominate each other and provide narratives completely unprompted or unsolicited. They'll reach out to somebody within the executive command team and say, I'm not sure if you know this, but this person really got us through this shift, or they went above and beyond for these reasons. And we'd like to see them recognized and acknowledged. So any employees who are currently listening, I hope that you will continue to do that. It is important to recognize each other, and I think it has a lot of meaning when the source is somebody who does work closely alongside you, and maybe they don't know that you're observing all of the things that you are. So for the month of September, we're proud to acknowledge and recognize Correctional Officer Mohammed Sawatore, Case Manager Michael Hennigan, and Purchasing Coordinator Zakia Butler. I have also included on there previous month employees who we've recognized during this meeting, and really appreciate all of the work that is done by everybody at George W. Hill, especially these 3 for the month of September.
Just had a question. Is this honor something that could go into the county newsletter, or are the names of people not something that would be good in the public? Because our PR department's continually looking for material and good stories for the newsletter, which goes out throughout the whole county for people that sign up. I'm just wondering whether that would be something.
I announced their names here in a public meeting,
I
so
know.
hopefully they don't object to that. So I think that I could definitely be sending more notifications so that does become a part of the memorialized process in the county newsletter. And I think that many people would maybe appreciate the additional recognition, and be able to share that with their families too.
I think the public that actually, doesn't tune into this, but maybe reads the newsletter would like to know that we think these people are doing great jobs up there. So I just throw it out as something that we might want to follow
In
up.
terms of recruiting more employees. Yeah.
Okay.
Thank you for that suggestion and comment. So speaking of the Public Relations Department as well as the Executive Office, Delaware County sponsored an ice cream social on August 17th. And it really was, I included some pictures, a wonderful event. So though it was only for 2.5 hours, we were able to all come out as, staff was relieved so that they would have the opportunity to come out and enjoy ice cream from Mr. Softy. We had fun debates about whether we call them sprinkles or jimmies. And you were able to laugh and appreciate the human side of all of us. So it was really nice. I don't know of another time when an ice cream truck might have been on prison grounds, but I enjoyed interacting with staff and seeing them be able to take a few minutes away from the hard work that they are doing in the stressful environment that they work in and be able to celebrate something. So we did also, through support from the county, coordinate to have leave behind frozen treats, so popsicles and things like that, for our second and third shift, since we would not have the Mr. Softy truck on site for those times. So we did try to do some additional recognition for all of our staff, though I hope in the future we'll also, as an agency, look towards really special moments like this for our off-shift personnel as well. But wanted to share this with the board just because I thought it was a really creative idea, and we certainly appreciated it. So keep those things coming. We've talked in the past about different cost recovery items, and all of these funds go into the county general fund. So from processing fee, in the month of August, we had $35,288.47 recovered. Year to date, you can see that number to the right. Damage to prison property or restitution, $265.19 was recovered. Medical visits for the copay process, $694.36 within the month of August. Postage, $46.70. And those checks of persons who were released with under $1, that's what the deposited to inmate welfare indicates, is $5.72. So though it doesn't seem like a large amount, the amount of work that we've been able to reduce for checks for 13 cents has been appreciated by staff. So all but that last line item do go to the general fund. The one for the checks at the bottom goes to the inmate welfare fund. We also wanted to make sure that we were providing routine updates for contracts that we have in the facility. So Aramark has the contract for both dietary and commissary. And through a lot of exploration from the incarcerated population, getting feedback from them during block rep meetings or when we might be walking throughout the facility, they have requested for an expanded menu to be available. Some of this is related to supply chain issues. They would like there to be different items or substitute items available. They are also getting used to this vendor. Keefe was the previous commissary vendor, and they had some agency-specific items that the population really did like. So they're trying to find something that would be a similar replacement to those items. We did meet with the organization, and they provided a master list of available items. It's currently under review. We're comparing it with the list of items that was requested from the incarcerated population, and we will be working to execute an expanded menu in the future. We're also going to be ensuring that we are finalizing some of the challenges with ordering on the tablets to be fully functional as well, to make it as easy as possible for the population. In terms of dietary, we've also met with their command staff to ensure that we can increase the availability of vegetables and fruits, as well as making sure that there is sufficient variety within the diets for the incarcerated population. We are still currently in conversations before we finalize those. We did discuss that none of these will have a budgetary or financial impact, so this will not require an amendment to the contract, as it is not increasing the cost for anything. If we were to explore that route, we would, of course, address that appropriately through the process with the county. We very excitingly expanded and implemented a one-to-one tablet availability within the entire facility in the month of August. So two big things happened. They had increased out-of-cell time, and tablets are available for every incarcerated person in the institution, with the exception of some that it may not be safe to do so. We are currently in conversation with the company to discuss how we might expand the capacity of the wireless access points in the facility. It doesn't seem to be effective, even though we did do upgrades to have in-cell coverage for all persons. Some are able to access the tablets' full functionality while they're in their cells, others are not. So we are revisiting how we would conduct a survey to make sure that we can do that. We're also evaluating the current utilization of the tablets, which programs and services seem to be most frequently accessed, so that we can ensure that we provide a variety of services for the population, while also looking at the contracted costs associated with the utilization of the products that are not available for free. So we did see a pretty significant increase in terms of messaging. It increased by 154% within last month to this month. Phone calls, we didn't see such a great climb, but I do believe that was likely related to the outage that we had. We had 234 EDOVO, which is the Education Learning Management System, courses completed. That's compared to 29 the month before, so it was an increase of 707%. So this is one representation of you give people an opportunity and access, they're going to seek resources and education.
Just as examples, what are the courses? What might they be in?
There are some workforce development courses. There are some psychoeducation courses that are available. I didn't review which ones they were completing with the highest rate. That's part of our kind of evaluation process. We want to get a little bit more data. And thanks to Administrator Shaw, she worked with ViaPath to make sure that we're consistently getting that data from them so that we can use that information and make informed decisions. But they were able to provide us some numbers that she quickly analyzed, and we saw that we went from 53 unique users to 196. So the word is definitely getting out there. We want to figure out what it is that they want and what they might need so that we can increase, efforts for recidivism as well as other resources that they might be seeking. So my hope is over the next couple of months, when we have more data behind this, we'll be able to articulate this way more.
Warden, with respect to the, I guess the signal or lack of it in places, how are we doing that? Do we have engineers out there to look at why there's no reception or whatever?
So ViaPath was the organization, formerly GTL, that installed the wireless and did the wiring. Right now we're working through their engineers and we'll likely need to do a survey to determine what the accessibility is and how many different points we might need. I too believe it would be advantageous for us to explore that independently as the county with our engineers to see which will be the most opportune way to move forward with this. I think there may be value in us providing that infrastructure and resource as opposed to a contracted organization. And then it would also allow for, some of our departments to service it and make sure that it's working. We could get healthcare to be able to access wireless. There are a lot of advantages. There are some, obviously, risks or benefits for contracting out that service, but we're definitely looking at what is going to be the right approach to move forward with the infrastructure.
Thank you.
So this slide is to revisit, did we skip ahead?
Yeah, I think you.
Okay, thank you.
Purchasing, right?
Approval to purchase. In May of 2022, I had originally come to the Oversight Board with a number of different proposals. And in doing so, we've learned a lot through the county procurement process as well as county code. I certainly had a misunderstanding because we were seeking inmate welfare funds as opposed to county taxpayer funds for these initiatives. We had obviously a misunderstanding of the procurement process, and we definitely understand it now. So that's why we're revisiting this. These are not new concepts. Previously, we had talked through. I will say that it was advantageous that we utilized central purchasing and followed the county code because we had a pretty significant reduction in cost for the activity centers and pull-up bars. So I am seeking Oversight Board approval for us to present at council the items that did go out for an invitation for bid. The bid was closed on the 7th of September. For the activity center and pull-up bars, we had one proposal submitted, and that proposal came in at $68,810, which is actually $21,536.40 lower than the quote that we had received, even though we did seek 5 independent quotes for competitive pricing. So we did see a significant reduction. It is meeting the specifications that we had discussed previously, that we had support and approval for, and we would be seeking this funding to come from the Inmate Welfare Fund account. But we would ask that you provide your support so that we could present to council next week that we would like to execute this bid process and purchase the goods.
Warden, is this a different vendor than the last time?
This is a different vendor.
Any difference in terms of the quality of the product, or?
It meets the same specifications, so a number of different vendors have the equipment available. For whatever reason, this vendor was interested in providing a much more competitive pricing for us.
Great, so I'll entertain a motion to support the purchase of the activity center and pull-up bar equipment.
I'll make the motion to support the purchase of the fitness equipment and recommend it to council.
I'll second that.
We have a motion and a second. Any further questions or comments from board members? Hearing none, all in favor?
Aye.
Aye. Any opposed? The ayes have it. Thank you, Warden.
Thank you. So very similar context for the next item, which is the visitation chairs. We did have a bid that was lower that then went through the county procurement process by approximately $2,100. Unfortunately, the preferred vendor chose not to submit a competitive bid. So going through the county central purchasing process and competitive bidding, we had 2 respondents to the request for bid. Total cost is at $36,807.40. And we would be seeking to purchase the chairs, again, meeting the exact same specifications as we had previously sought for the block visitation chairs to present for council next week with hopeful Jail Oversight Board approval.
And so, Warden, that means, again, these chairs would have a significant weight such that an individual can't lift it. I think the last ones were like 300, 400 pounds or something like that.
Yes, so they do insert sand in them to weight the chairs down. You can actually determine the weight that is required. So ones that don't move, they can weigh up to 500 pounds. Ones that you might be, moving to clean the floor area where they were, they would have recommendations for how much a chair like that should weigh, but they can add that with sand.
Great. And any color as to why the initial vendor chose not to resubmit?
I don't know. I know that not every vendor utilizes pen bid, but that doesn't necessarily mean that they might not in the future, especially if they lost the opportunity for business.
Do we think they knew about it? I'm just wondering if, even though it's on pen bid, there are ways to let people know that there's especially since they had already put something in before that you liked or that we all liked. Mm-hmm. So I'm just wondering.
This bid had just closed, and admittedly, we did not follow up with the central purchasing team, so I don't want to speak for them in their process. I would imagine, because we did provide them with all of the quote information that we had, that they had done due diligence in exploring those options. But we can't make somebody submit a bid. So we did receive 2 respondents. If we had received none, I imagine we could pursue. But at this time, we are recommending the lowest bidder for the block visitation chairs.
Okay, so at this time I'll support a motion to recommend the purchase of these visitation chairs at the price quoted.
I make a motion to support the visitation bid.
I'll second.
We have a motion and a second. Any further deliberation on this?
Mr. Chair, just as a point of reference, pen bids is not an exclusive process. We also advertise in local media. The problem here was that the bid was not resubmitted, so it wasn't part of the competitive process. The matter was reviewed by the county solicitor's office, and in order to ensure we remain compliant, the previous bids we received were determined not to be part of the process. So to respond to Deputy Vice Chair's comments. There are other ways that people can become aware of the opportunities that the county is placing. Also, going forward, in general, we're going to engage a supplier diversity manager in the county as well to make sure all of our opportunities are made aware to not only the primary contractors, but also to small disadvantaged minority-owned businesses as well. So while this is a slight increase in cost, it's worth reinforcing the process to make sure that we maintain the integrity of the county's bidding system.
Thank you, Director Lazarus.
I would also say that I did review the packages that were received, and it was a really complete package with, everyone, crossed the T and dotted the I. It looked very good. I'd have to say that our central purchasing put together a really good package.
Yeah, and look, I think this might have delayed the purchase by a month or so, but at least we're saving, by my math, just about $20,000 in inmate welfare funds, which can go somewhere else.
Yeah.
Yeah. And it's, I really do appreciate we've had multiple departments who supported, the procurement as well as the education for our staff as we're still learning, the entire process, converting from a private organization to a public entity. There are a lot of changes that you don't necessarily consider in process. So it's definitely been a worthwhile exercise for us. And then I did just note that the Inmate Welfare Fund does currently have $3.88 million available. That doesn't mean I'm going to spend all of it, but just in case there was some needed reassurance that we are not depleting too much from the funds that are available in making these purchases.
And I think that's important to note too, because when it's reported, these are amenities for our incarcerated population, but it's actually not being paid by taxpayer money. So I think it's important, and it's going to the right place. So if the Delco Times wants to report on that, that would be good for them to note.
If I could add one more observation on procurement too. The warden, Deputy Warden Mistrati, and I met along with Central Purchasing Director Jackson. Our goal is to move towards ensuring the processes are in place so that there can be a delegation of authority that's allowable under the code, so that things can move properly but also more expeditiously through the procurement process at the prison, which helps everyone out and also lightens the load a little bit on central purchasing. So everybody is a willing partner to make sure that the processes are compliant but also efficient. So thank you, Warden.
Thank you.
All right, unless no further comment, I'll call the vote on the motion before us. All in favor?
Aye.
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 Any opposed? The ayes have it. All right, Warden.
Thank you. So also, something that Jail Oversight Board had approved, Sean, do you mind advancing? We, as well as County Council, the kind of discovery of a nationwide expert, Dr. Jeffrey Metzner, who has over 40 years in psychiatry and the field of corrections, was able to do a site visit for 2.5 days at George W. Hill. And he provided a very comprehensive look into current process within the institution. He was able to review policies, reports, training materials, as well as procedural guidelines, post orders. He was able to conduct direct observation of the way that these processes are implemented throughout the facility. And he had kind of an open access to the entire facility, including the incarcerated population. So he conducted staff interviews as well as incarcerated person interviews and observed a significant amount of the actual physical environment. He has identified some areas of opportunity, some of which were also identified by our staff, so it was extraordinarily helpful to have an expert co-sign. It really validated that we have skilled, competent staff on site that we're thinking in the right directions in terms of mitigation measures, as well as appropriate risk factors, and identifying areas of opportunity for change. So some of the more notable areas of opportunity that he identified suicide, we're renovating or modifying current cells that we have to ensure that somebody who was at a high risk of suicide, either thought or behavior, would have a suicide proof. And I did put it in quotations because it just doesn't sound good, but you know, you want to have an environment that is safe. Without depriving somebody of, you know, items that they require and deserve to have from a humane perspective. So it is not putting somebody in a room with absolutely no fixtures. It's providing them with a bed to sleep on that is safe for them to have, and fixtures as well as amenities that wouldn't increase their risk. So very much appreciated his conversation and look into that. And then a number of different opportunities that certainly are requiring us to increase and explore our contract to negotiate, or our contract relationships with our healthcare services provider. So we are in a contract with WellPath as a county, and the current staffing matrix will need to be adjusted to look forward to the programs that we currently have, as well as ones that we want to expand. And mental health services in the field of corrections is typically very lacking because of a resource issue. So we need to anticipate that that is a gap that must be filled, and begin to recruit for the necessary staff to ensure the provision of services is available. He did note that there were a lot of things that were done very successfully. So he did a number of record reviews, looked at medications, looked at diagnoses. He identified that people are being referred appropriately to services, so it's not a competency issue. We do have staff that know when somebody should be escalated, and that's not just our healthcare team. We see that from classification, our lieutenants, our sergeants, our officers. Everybody is comprehensively taking this on as a real life safety issue for the population and making sure that they're getting connected to care. He also encouraged, we have some really outstanding staff, and I'll say Nina, I won't give her full name, but everybody in the building knows who Nina is, and she has incredible ideas. And in practice, she has so many different education and competencies. She's duly certified, and she has done a lot of initiatives independently throughout the institution. So from his perspective, he encouraged us to really memorialize what she does into policy so that that is consistently enforced and managed throughout all of our personnel, as well as our procedures within the institution. And then lastly, he indicated that additional training for specialized management units or specialty populations, especially the needs of the population that we're seeing currently, be offered to multiple staff, but prioritizing those that frequently work the housing units to ensure that they can identify any risk factors that might present. Overall, I felt that it was a really incredible experience for the facility. We are extraordinarily lucky that we had a resource like Dr. Metzner, especially on such short notice. So I think that we learned a great deal, and we are enthusiastic about enacting some of the changes and continuing with the momentum for those that we had already started.
Well, I'd like to thank you, Warden, and the entire team for their willingness to be open to what we can do better. I think especially when we're in this still point of infancy in the the public management of our jail. We certainly in an area like suicide prevention, we have to be continuing to strive to do better and better. So I'm glad that folks really took this opportunity as best we possibly can to get what we can from it.
Thank you.
I was just wondering, it seems that, the documenting of processes is always the thing that gets in my office. I was like, I need to get back to that, and it takes sometimes a long time. I'm just wondering, maybe in a future meeting, you might be able to inform the board of a possible schedule of trying to document that, what you want to memorialize in some kind of written documentation. But you probably haven't even had a chance to breathe since getting this done. So sometime in the future, if you could do that.
being busy isn't an excuse for not doing. But I, so I'm
There's so much
a
time in a day.
I know. But I'm a visual person, and I'm as we can see, because I bring pictures and slides. And I also think that there is an importance of memorialization. I frequently use the saying, I hate well, what if I'm hit by a bus? So, when you win the lottery tomorrow and you're not here, how are we going to absorb everything, all of the knowledge and experience that you have to continue these processes? So we've been saying that with a lot of frequency. I've got a lot of people who are going to win the lottery in my facility, and we've been working on memorializing, because that's just such a missed opportunity. I see that here. I see that in previous employers. I think that we could all benefit from making sure that we carve out the time to really communicate these things. And you're right, and I should, and I will work towards providing, a schedule.
I just think the board would be interested in knowing it, but again, I think it's, it's a future task, so I wouldn't even expect that you would be, necessarily thinking that way yet, but I'm throwing it out for consideration.
Okay.
Thanks.
Thank you. And then wanted to make sure that there was a public kind of acknowledgement that we did have an interim deputy warden of security under a professional services agreement. So Michelle Miller served as deputy warden of security from May 31st of 22 until August 16th of 22. And she had a very exciting life event that happened earlier than was anticipated. So she did have to leave us pretty abruptly, but she is doing well, as is her family. And we are very grateful for the time that she spent in the institution. I think that it was supremely helpful for some of the staff to be able to, again, like Dr. Metzner, experience somebody who has over 30 years within the field of corrections and has served in many different command roles and positions, and was able to coach alongside and work to develop a lot of the staff within the facility. Deputy Warden Hector Portillo, who I introduced last month, began on August 8th, and he was working side by side with Deputy Warden Miller and ensuring that a transfer of duties was smooth, communicated, and collaborated. So the passing of the baton, we didn't drop the baton. We're able to continue some of the efforts, and it was really cool. I'll say that. I don't know if I can, but to observe them, as the three of us would meet and just watch their interactions and observations, as they were both seeing a lot of the same things that needed to be addressed or expanded upon. So I felt like they had very frequent open conversations for an intense couple of days. They spent many 12+ hours together working. So that was, I'm sure, exhausting, but exciting, because they were really feeding off of each other's energy and enthusiasm. Deputy Portillo has identified a number of different initiatives and areas that he wants to spearhead, at least through the end of this year, and then we'll look forward for longer-term goals. But we are continuing to make progress in areas like intake, procedural items, revision of policy, and training are the primary areas of focus that he is going to be, again, project managing as our Deputy Warden of Security. And for now, I would like to turn the presentation over to Deputy Warden Falley so that he can provide an update on programs and support.
Thank you, Warden Williams. Good afternoon, Chairman Madden and General Oversight Board. August has been a very, very busy month, as you guys heard from Warden Williams. As far as programs support, we made some notable progress. Since we took over April 6th, we had a total of 20 GD graduate. We really invest in education to our incarcerated population. We increased our substance use team. We went from 19 to 82 in the incarcerated person to enroll in a substance use program. We enhanced our workforce development. with 20 flaggers, and as of last month, FirePath added a new workforce development resource for our incarcerated population.
They had a big pack.
Somebody talking?
I think it's just
Yeah, I think someone on Zoom is not on mute. Okay.
So VIPA added in the month of August a resource called Honest Job for Access for Workforce Development, focusing on Corey-friendly employers and industry who hire people who are affected by the criminal justice system. So it's a platform in which they'll go to the tablet and they fill in their application, and depending on what the crime is, they'll provide them the type of job they should focus on, either on culinary, on gardening, or coding. We also expanded our reentry services, and Michelle will talk more about the Inside Out program. WellPath hired an MET health coordinator, and she will be providing mental health services beginning at the end of this month. So we're looking forward to that. Currently, we have 27 individuals who are confirmed Suboxone treatment, which is every month, it's increasing. Warden talked about the WellPath service as far as that there was 95 COVID tested. We also have 523 incarcerated persons, which represent 40% of our population. So WellPath is working with us to make sure that our incarcerated population are vaccinated. One of the biggest increase for the month of August is the increase of detox and withdrawal since the month of July. So we saw a significant increase of people detoxing. For the month of August, we have 333,360 incarcerated persons that came to our facility detoxing and withdrawing, compared to the month of July, which was only 1,950.
Deputy Warden, can you say that again?
So in the month of August, we saw an increase of incarcerated persons withdrawing, detoxing from the community. The number was 3,360, compared to July, which was only 1,950.
Sorry, what's that? What's the unit of that? Because it can't be individuals. I mean, we only have a population of roughly 1,300
So
people.
some individuals are in and out, right? So the same individual might come in and leave, and might be suffering from substance use disorder or detoxing from alcohol. So those, and we saw a significant increase on it, and we also realized that a lot of our population is also increasing.
Okay.
Do you guys have any question? I'm sorry, go ahead.
I'm sorry, I just have a question to follow up on Chairman Madden. So you provided the number of doses and then the in-out of the population. Do you have the number of individuals who were treated, whether it's once, twice, multiple times?
The number of individuals that was treated for the month of August?
Yes.
Yeah, 3,000. The individual. No, I don't have the individual.
Okay.
No, I don't. No,
All right.
no.
I got where you were going.
Yeah,
Yeah.
sure. Forward.
No.
Thanks.
You're welcome.
And where are we, Deputy, where are we at with, I know we have an increase in participation in the substance use programs through PrEP, and you talked about the wellness coordinator for the behavioral services. Where are we at with increasing substance use services, like as far as setting up the IOP groups that, had been in there previously with the Vivitrol, and where are we at with, I know you had talked about maybe a modified therapeutic community that you were looking at. I was just wondering the status of all those things, especially as we're seeing a significant increase, to be proactive, to have these services and support available.
Good question. So as far as substance use services, we increase our PrEP services. At the same time, we're offering PrEP services to the participant of the Suboxone program. We're currently in the planning phase of the TC program. So right now we're trying to figure it out, like the unit, the curriculum, and all that. It takes time, but we're kind of in the final draft process, but we're in the implemented phase.
Okay.
So more to come in the near future.
All right, great.
Any question before we talk about reentry? No? On the October report, we're going to do like a quarterly evaluation so you guys can see the progress from July to September.
Great.
Okay, thank you. Ms. Shaw?
Thank you, Deputy Ward.
Thank you, Deputy Warden Fowley. Good afternoon, members of the board. Thank you for the opportunity to provide reentry service updates. I'll start off with our grant opportunity updates. For those that are tuning in for the first time, and as a refresher for our regular people that tune in, the Pathway Home Grant provides justice-involved incarcerated adults with critical skill building and supportive services prior to and after release so they can re-enter their communities and the labor force. We met with EDSI, Delaware County Workforce Development Board, on August 18th. EDSI is currently working on the grant's narrative, timeline, and budget edits. EDSI has extended offers for the position of peer mentor and business service representative. A peer mentor will coach, guide, and support pre- and post-release participants. The business service representative will work with employers and provide work-based learning opportunities for the program. Delaware County Workforce Development Board identified a program coach. The program coach will provide assessment and case management pre- and post-release. At GW Hill, we have identified a workspace for a full-time facilitator and are collaborating with EDSI on a referral for clients. We expect to start the first cohort in October with between 10 and 12 participants. As a refresher on the Pell Grant, Delaware Community College was chosen to participate in the national initiative to bring education and training to incarcerated individuals through the federal Pell Grant program, identified as the Second Chance Pell Grant. The Second Chance Pell Grant will provide incarcerated individuals with access to high-quality post-secondary education. GW Hill program staff met with Delaware County Community College Dean McFadden and Associates. We had an official kickoff meeting on August 16th. In partnership with the college, we plan on providing credited, non-credited, and certificate course opportunities that will provide a pathway to sustainable employment. We are in the initial stages of drafting scope and service and are hopeful to have an outline next month. The goal is to have the course running in 2023 spring semester. And we're very excited with our initial response and feedback from the recently begun nationally recognized Inside Out program. The first class, public speaking class, kicked off August 30th. With 9 inside students and 9 outside students. As the name suggests, inside out. Inside students are our incarcerated learners, and outside students are those students enrolled in DCC. The college course is designed to introduce the concept of effective public speaking through individual presentation, group work, and evaluation. Inside and outside learners collaborate as partners to navigate through the course. As we enter into week 3 of the fall 22 semester, feedback from the participants and staff have been nothing but positive. Inside students are enjoying the opportunity to participate in education at this level. And class is every Tuesday night, so class starts in about an hour. And I also want to give recognition and thanks to Councilman Madden. We're extremely appreciative for the connection to Professor Putman and the Inside Out program. This is the first nationally recognized Inside Out program in Delaware County, Pennsylvania. Thank you. Any
It's off to a good
questions?
start. All right. Unless there are any other reports from wardens or deputy wardens, I think we're up to subcommittee reports. Any updates from our subcommittee leaders? Hearing none. Public comment. Any members of the public who wish to speak? As always, for the record, please give your name, your address, and please limit your comments to 3 minutes.
Sure. Mary Austin, 1036 First Avenue, Media, PA 19063. Thank you all for your reports. I just had some questions just for clarification. Excuse me. Will the Dr. Metzner report be made public? I wanted to have to follow up about having NA or AA meetings. I know before it was a COVID issue to have people come inside, so I wanted to see if that was being reconsidered. Question about the Delaware County Community College, and wondering if that is also offered to the juvenile who are in George Hill. And then just wondering with 34 GED tests and only a few passing, like what kind of support do those get who have not passed the GED tests? It just seems like a low number for so many final tests or numbers that have passed. That's it.
All right. I mean, typically it's not kind of a Q&A in public comment, but I think if the warden or deputy warden would like to clarify any of the questions asked, we can. With regard to the Dr. Metzner report, some degree of it we will be sharing in public, but understanding the fact that it has, safety implications to provide in 100% detail, that degree of granularity won't be released, but we're happy to provide, as we did today, frankly, some of the more thematic takeaways that we have to address. Warden.
Sure. So I will address the first two, and then hopefully Deputy Falley can address the second two, and then he can address the last one. So NA and AA meetings, yes, we did suspend initially because of COVID-19. We have been doing institutional clearances to get volunteers set up for when we are prepared to expand those services back in the facility again. So I've reviewed a number of clearances, and they have been engaging within the volunteer training. We have been slowly implementing, because it's my desirable to make marked, successful, small, measurable goals as we proceed forward so that all programs can be supported and successful without taking too much burden on the current staff that's there. So it is a very delicate balance in making sure that we don't add on too much too quick, because then we will not be successful without all of the staff there to provide infrastructure. So we have had some organizational groups. We've been increasing religious services, and then we will, I believe, be reinstituting AA and NA or other 12-step mediums very soon. In the interim, we are providing Prep 1, Prep 2, and other substance use services within the facility. So we are still meeting some of the need, just not filling all of the gap. In terms of DCCC, so Delaware Community College does require that you have an education from a high school or a GED prior to enrolling in a college class. So our juveniles are not currently eligible for the services that are being provided through the Inside Out program, but we're continuing to look for different resources that will be specific to be provided to the juvenile population. Though ideally, we won't have to be seeking resources because less juveniles will be incarcerated. But we are definitely looking at what might meet the needs for that population. And then GED tests, I'll say this, but he'll probably say it far more articulately. Testing is very difficult. And some of us do well with tests and some do not. And there are multiple different sections within the GED. So there's a math section, and some of them are more difficult than others to pass through. I have full confidence in our academic team that they are working to support persons to make sure that they can achieve GED, but sometimes that does not always happen, and Deputy Fowley might be able to add a little bit more structure to that response.
Thank you. The type of support that our incarcerated person receive for the GED is we have 2 academic instructor, one in the daytime, one in the afternoon, one from 8 to 4, the other one from 12 to 8. And they spend a lot of time with the individual incarcerated person and help them pass the GED. We provide 10 different GED testing sessions, so they have 10 times through the month of August to pass their GED. And it is very, very challenging, but however, we don't give up on them. And if they don't pass in August, they might pass in September when it's open to when the test is available. They go to our law library and they sit down to the computer and they actually do this. I was witnessing them a couple of months ago. It's very hard, but however, that we have hope, and both Ms. Kruski and her team, they are very, very dedicated to make sure that our incarcerated person has their high school diploma.
Any other comments from the public? Hearing none, any last board member comments for today? Executive Director.
Thank you, Mr. Chair. I have a couple items to go through quickly. I had the opportunity to talk to Interim Deputy Warden Miller before she left, and she had some exceptional things to say about the transition and changes that are occurring at the prison. She also had some very nice things to say about life in Delaware County. So I'd share that with you as a follow-up. With regard to the budget, the Budget Management Director's proposal is not due to me until the first week in October. I will commit that we'll come back in October and have the opportunity for the board to participate before that budget is a done deal, because my budget is not due to council until the first week of November. On the capital improvement side, I talked to Public Works Director Floyd actually right before I came down here. The permanent repair to the domestic hot water system is actually on council's agenda for next week. Things that are going through the design process are security and surveillance, the HVAC system, the roof replacement, and the kitchen repair. The proposed budget right now, the working budget for the CIP for next year, actually contains in excess of $30 million in repairs at the prison. So it is among our highest priorities. Earlier today, we had the opportunity to appear with Attorney General Shapiro about the opioid funds that the county will receive through this settlement with the drug manufacturers. I bring that up because Warden Williams was part of and is part of the task force we've assembled to find the best way to apply those funds and to fill in the gaps in our support system for people who do have drug and substance addiction concerns. Also, finally, I want to call out Mike Resnick sitting quietly in the back of the room. Not only is he also a member of the opioid team, but he is working with Julie Del Muto of our GIS and Data Innovation Center to map out and to collate databases. It's been a bit of a slow slug through through what's there, but through his efforts, we'll be able to not only tie the services we provide to people who come into our care, but also look at how we provide services post-release. So that's a very exciting opportunity and task that he's taken on, and one that has its challenges as well. So we thank you for that.
Thank you, Howard.
And Chairman Madden, I just wanted to add to the public comment and just ask the warden deputy is if we have AA and NA literature available in the blocks, and an opportunity for individuals to participate in a peer-run AA or NA meeting, especially until services come into place, and also for cancellations and when they're not available. Just wanted to make sure that those resources would be available for people that want to do that. So.
Try to respond with the microphone just so people people listening can hear. I think it's an excellent suggestion, and as you were saying it, I was thinking there's got to be a way that we can, do the meeting opening, we can do the, a number of the different literature resources, the big book, on the tablet, and find ways to really get those resources available while still working towards in-person meetings, because those are so interactive to be able to share those stories of strength and hope with each other.
And I don't know what the capability is of the tablets, but during COVID, there is a just immense resource of open AA meetings through virtually. And I don't know if that's something, I know maybe not on an individual basis, but if that's something the facility could host.
Internally.
Exactly.
I don't know if any facility is doing that, so we might have to be the first and try that out. I appreciate that. Thank you.
Absolutely.
Well, hopefully we can get to in-person in short
Yeah.
order. That would alleviate all of this need.
I have a question, and I'm sure the warden is probably going to have to stay at the podium. My topic is COVID and COVID vaccines. You said that you hadn't been vaccinating. You haven't had clinics.
We did not in the month of August.
Okay. I'm just bringing this to light because I was on a healthcare coalition call today with the state regarding COVID vaccinations, and it had to do with the boosters. So I'm sure our health department is well onto it, so I'm just encouraging conversation with our health department. The boosters that are now being offered are not the same chemical component as the original 1, 2, and I think 3, 4 were the same, but now moving into the next stage, they've changed it. So I just, knowing we have a vendor there, but also knowing sometimes one part of the county may not talk to the other, I just encourage you, if you're going to be doing boosters, that you stay in touch with our health department.
So the bivalent booster is, I think, the one that you're referring to, and it is specifically, kind of created for the variants that have been seen most recently. And though Director Lyon and I have had some peripheral conversations about when her department might be able to move forward in supporting our facility, we've not set anything on the calendar. But I do know that those are available locally, so would certainly encourage anyone, including myself and all of my staff, to explore that. There's CVS on Baltimore Pike that has the boosters available. I did check today, but it is an excellent point because it is important that we continue the mitigation efforts as well as educating the population on the risks and benefits so that they can make informed decisions. And I agree, we need to continue to partner throughout the county to support agencies. And I'm a facility that requires a lot of support, so thank you.
Well, given the particularly vulnerable nature of, a population like a jail, we'll certainly press for the availability as soon as we can.
Yes.
Any other comments or questions from board members for today? If not, I'll entertain a motion to adjourn.
I make a motion for adjournment.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? We are adjourned. Thank you all.